Hey there, my name is Tracy, health coach and personal trainer and founder of HighEnergyGirl.com. And in today's video, we are going to talk about all the lies that you have been fed by the government, by the pharmaceutical industry, by the health insurance industries, and more. And be sure to stay till the end because I am going to give you an offer to get my new book for free. It is called No Frickin' Way. 21 days to ditch the diet and lose weight the keto way by loving yourself to health. So how did this start? Well, early in the 20th century, Carnegie and Rockefeller teamed up and had a brilliant idea. They decided that if they spent all their money allocating funds to the medical schools that were pharmaceutical driven, that they would make more money because they would sell more pharmaceuticals and they would sell more of the products to make the pharmaceuticals because they were already the oil magnets. And that's one of the products that makes a pharmaceutical. So what they did was they provided massive funding to those pharmaceutical schools and made it look like, really luxurious for prospective students to go there. And so what happened with all this is that all of the holistic schools, they just kind of fell to the wayside, okay? And they kind of just shriveled up because they didn't have the funding and nobody wanted to go. So all the doctors that went to these pharmaceutical driven schools, they had this vision. They wanted to help people. Their heart was pure. However, they didn't learn anything about nutrition, still happening today. And so what they were taught is how to prescribe drugs to help treat symptoms. Now, they're not looking at the root cause of that symptom most of the time. And so we're putting Band-Aids on the symptom, and then the drug companies are the ones who are making all the money. Because let's face it, we know that while doctors' costs are going up, their insurance benefits are going down. And so it's not a win-win for them in the end, even though they have the pure heart. So pharmaceutical companies win. They charge ridiculous amounts of money for pills. My brother was on a pill for Hep C. I want to say it was like $1,000 a day for the pill, right? Well, he can't afford it. He is a brain injured patient. So who pays for it? Well, it is Medi-Cal, okay? So who is subsidizing those costs? Well, those costs are all subsidized by the insurance companies, by the insurance premiums that we pay, right? As healthy people pay these high insurance premiums, but I digress. So speaking of insurance companies, how does that play out? Well, we know that our insurance companies drive our healthcare. They actually are the ones who determine oftentimes if we get things done or not. And what that means is if we need to have some major procedure and they're not going to cover it, oftentimes the patient will say, oh, I'm not going to have that done because they can't afford it, right? And also insurance companies only cover medical, like traditional medical doctors. Very, very few times do I see a naturopath or a functional medicine type doctor get covered. They cover pharmaceuticals, but they don't cover supplements. They cover your diabetes dialysis treatments, but they don't cover your massage or your gym membership. So what they're doing is they're treating disease, but they're not preventing it. We want to teach people how to prevent the disease so they don't have to suffer. And don't you think it's cheaper to prevent disease than it is to treat it? Absolutely. I always say you pay the farmer now or you pay big pharma later. And that is way more expensive. Plus your quality of life goes way down. Wouldn't it be awesome if insurance companies actually helped us pay for the holistic solutions, pay for stress management practices, pay for things that keep us healthy and well? It will save them big time money in the long term. But let's face it, pharmaceutical companies are the ones who are controlling everything because they are the big profit centers. So they're the ones who I believe, and I could be wrong, but I believe they're the ones who are holding the insurance companies hostage by creating this system that gives them more money. Now we're going to talk about the FDA. So they are like a big giant in the industry. And oftentimes what they do is they have this big buzzword, FDA approved. Well, did you know that supplements don't have to be FDA approved. So some people say, well, is that FDA approved? Well, no, but it doesn't really have to be. It's only for drugs, okay? And oftentimes FDA approved things aren't really good because they haven't based that approval on long-term studies. That's why you see so many side effects. Like, how is all that stuff slipping by and actually killing people? Side effects are actually, last I heard, I think they're the third cause of disease, or they're the third cause of death in the United States, coupled with the misuse and the side effects of them together. It's the third cause, like heart disease, cancer, pharmaceutical drugs, okay? So why are they being passed without deeper scrutiny? And you know that they're modeled on herbs? A lot of pharmaceuticals are actually modeled on herbs that are used in nature, that have been used by shamans forever, which are like supplemental type things, right? But since they can't charge a high premium, I mean $1,000 a pill for something found in nature, they can't patent it, so they lose a lot of money that way. And next, we are going to talk about big food. This is the thorn in my side, big time thorn in my side. Well, I live on an organic farm here in Northern California. And so I see a lot of different things with food, and I've learned so much in the last 12 years studying nutrition. It's crazy. So let me tell you, the USDA government food pyramid or my plate or all that stuff is based on a high carbohydrate diet. And the reason that came out was because long time ago, decades ago, there was a certain researcher who shall not be named who published a study based on 7 countries of data when he had 22. He was trying to correlate a relationship between countries that had a high fat diet or a high saturated fat diet with death from heart disease. Well, you know what? There was 22 countries that had data available, but he only published the ones that had 7 because they followed his curve. They followed his hypotheses, and the rest of them somehow disappeared. Okay, so that is how we came up with this big demonized saturated fat. So what has happened over the decades? Have Americans gotten healthier and happier? No. Our life expectancy has gone down. They have recently lowered the life expectancy rate for I think it's the 3rd year in a row. So that means that children born today are not expected to live as long as their parents. So something is broken, something is not working. All of the research, all the science and everything is not going to save our children. That pretty much blows, right? So the other thing is 1/3 to 1/2 of the kids today are expected to get type 2 diabetes. Well, what is that caused from? It is not genes, okay? It is not your genetics. It is from lifestyle choices. It is from the food that you put in your mouth. So what is the problem here? Well, the government subsidizes some food industries. Corn, wheat, and soy are highly, highly subsidized by the government, meaning for the farmer, it's really cheap to grow because the government pays for it. When you go to your grocery store, there's a huge percentage of food on all the shelves that are made with corn, wheat, and soy because it's cheap to grow. But do you know, number 1, it's genetically modified, most of it. And number 2, it is inflammatory. It causes a lot of inflammation, which causes disease in our body. So that is a big problem, right? We want to eat from the perimeter of the store, like mostly meat, vegetables, nuts, seeds. If you can tolerate, good quality dairy, that is where the healthier food is going to be. Single ingredient foods are the best, okay? So there you have it. I feel like we have this big problem. And if somebody in the White House wants to make America great again, that is how you make America great. It will save our taxpayers and our insurance payers a lot of money. It will save the government subsidies a lot of money in the end. And we will have a healthier, smarter, stronger population, which will help us win in this global economy. So if you want to read my new book, No Frickin' Way, there is a link below that you can click on it. And if you are watching this video during the free promo period, you're in luck because you are going to get the book for free. And you are also going to have access to my 21-day course, which is called the High Energy Transformation. And it is a kickstart to get your body so that you can age stronger, feel younger, and just be happy, healthy, and do a complete 180 on your life. You can age in health. You do not have to follow the trajectory of your parents and age in sickness. Thank you for watching. If you have any comments, please write them below. Give us a like, subscribe so you don't miss the next video because this girl is back and on fire to change your life.